So if you can just see here, all right, so at 2 centimeters, whoever is examining you, so a PV examination or paravaginal examination, the midwife or the doctor or whoever, it'll be the midwife that'll be looking after you hopefully, we need to assess you or to know how you're progressing in labour. So this will just give you an idea of what we're actually looking for. So somebody that's considered 2 centimetres, all right, they're not really in established labour, all right, even though their cervix is open a little bit. So we want it to be at least 3 centimetres, and some centres would say 4 centimetres, so it just depends what hospital you actually go to, okay? 5 centimetres then is when you're halfway through the first stage of labour, okay? And if you can see the little fontanelles or that little triangle there, that's what's on the baby's head, and that shows us the position of the baby, okay? So if you can see it here, so this is considered the anterior fontanelle, and it's a star. Can you see that there? Okay, and then this over here is like a triangle, okay? So when we're examining, what we're looking for is to see where these lines are, the sutures, where the little triangle and the big diamond is. And we know then what way the baby's facing. So if they're coming in this way, they're considered left occipital transverse. So we know that the suture is coming there. So that's how we know. And as well as that, before we do the examination, we'll feel your tummy just to make sure that it's definitely a head that's coming into the pelvis, and it'll give us a good idea how we can pick up the fetal heart. So if this baby's lying on the left-hand side with the head down here and my pelvis here, so it's at the anterior shoulder, so I know that that fetal heart is there. So it's a great way of knowing how to pick up the baby's heartbeat. This is one way of doing it. So this is called a Pinard. It's a really old-fashioned one, but it's fantastic because it'll only pick up a baby's heartbeat. It won't pick up your pulse or anything else. So it's a great technique for a midwife to be able to use, okay? The same for this is just a modern version of it, all right? So this is called a Doppler, all right? And I'll just turn it on there now because it's a bit loud sometimes, all right? Battery's gone in it, that's no problem. So really what we do is at the anterior shoulder and we listen into the baby's heartbeat, okay? So in labour, we listen in with the Doppler every 15 minutes or the Pinards every 15 minutes when you're in the first stage of labour. In the second stage, so that's when the baby's ready to be coming, we'll do that every 5 minutes, okay? But if you have an epidural or you're confined to the bed or there's a complication, you'll be on what we call the CTG, the continuous tachograph. Is that okay? Okay, so for the first stage of labour, we go from 3 to 4 centimetres, which is here, that's considered 5 here, up to 10 centimetres. So at 10 centimetres, you can't feel any cervix around the baby's head, okay? So at that stage, then you've finished your first stage and you're ready for the baby to be delivered. So if you don't have any pain relief like the epidural on board, you have an urge to push yourself. So I'm a midwife, but I don't need to, you're the one that's telling me that you're ready to have your baby, all right? And you'll give me the signs that you're actually bearing down, okay? When you have an epidural on board, you may not have that same sensation. So that's why there's an increased instance of vacuum or forceps delivery when you take an epidural. And the reason for that is because you're numbed. It's taken away the pain, so it takes away the urge to push when you actually come to full dilatation. Does that make sense? Is that okay? All right. So just say you don't have any pain relief on board, then you can deliver your baby whatever way you feel comfortable, okay? So for normal women in their first labour, labour as in from the first stage of labour can be anything between 12 and 16 hours, okay? So that's from 3 centimetres to 10 centimetres. On your second stage of labour, which is the delivery of the baby, that can be anything from an hour to 2 hours on your first baby, but it can be as short as 5 minutes if you have subsequent babies, all right? Or your second or your third baby, okay?